Vaccinations across the country are accelerating, and this is giving us all hope that we're going to be returning back to normal. For adults, what about the kids? So I've invited our friend, Dr. Tanya Altmann, to help us understand what we should be doing with our children as far as vaccinations, clinical testing, all the things that we've been dealing with as adults. But Tanya, nice to see you, Dr. Tanya.
Thank you for having me on, Carlos.
But the question is, what about the children?
That is the question. And, I think right now we are making a lot of progress vaccinating the parents and the grandparents and the caregivers. Mm-hmm. And truthfully, they are the ones that often bring COVID-19 into the homes. So although I do want the kids vaccinated, I think just vaccinating all of the adults in our population is going to make a huge difference to help decrease COVID-19 and really control this pandemic. But the good news is that the trials are up and running for kids, even babies as young as 6 months of age. Wow. So we will get there. It's just going to take a little more time.
What are they trying to find out in these clinical trials? The effects on children? Maybe you should give us a refresher on what clinical trials do.
Sure. So, clinical trials for kids are a little different for adults because the vaccine is already authorized in adults. So we know it's safe and effective. So for the kids, we're really looking at the safety data and the immunogenicity data. So for instance, are there any side effects? Is it safe? And are they mounting the appropriate immune response? We don't need to wait and send these kids out in the world and see, is it effective? Are they getting COVID-19? Because we already know that from the adults. But we need to figure out what dose is right for kids. Now, when you look at vaccines in the United States, there's some vaccines where babies get the same dose as adults. There's some where they get a lower dose, and there's actually some where they get a higher dose because it has to do with how their immune system responds to the vaccine. And kids aren't just little adults. We really have to test it in the age group that we're going to be giving it to be able to show parents that this is very safe and appropriate for kids to use and help parents feel comfortable. So with the COVID-19 vaccine, they are looking at a quarter dose, a half dose, and the same dose for adults right now in all the different age groups. And over the next year, we will have that data, and then we will have recommendations for each vaccine into how it should be given to kids of each age group.
I know you've been active in helping school districts around the country figure out when kids should go back to school and the threat that teachers would have or school workers would have by mixing everybody back together again in a school environment. What's been your experience? What's your advice about reopening schools and what parents should be thinking about as they think about sending their kids back to school before they get vaccinated?
Yeah, so it's been such a tough year for so many, but it's really hit school-age kids hard because they have been home for the last year. And although many, have technology in their homes and they're able to do a really good job with Zoom school, there are many children who don't have that available in their homes and they're missing out. They're also missing out on maybe the nutrition at school, the therapy school provides. And so it's really important that we get kids back to school now. And in LA County, in California State, and across the country with the CDC, there is so much guidance available for how schools can get kids back to school safely. And with the masking and the distancing and the testing and the hand washing and disinfecting, it can be done. It's not easy, but it can be done. And so I think all schools and all districts really need to focus now on getting kids back to school, even before they are vaccinated.
I know you're a pediatrician. You're a very busy doctor in the Calabasas area in Southern California, and you give a lot of advice, but you still see patients. You still have your practice. What are you seeing as children come to see you? Is there still fear? Is there still some trepidation? Tell me about that experience.
So, it really varies. I mean, there are many families that, they've been hunkered down at home for a year now and they haven't had any social interaction. And so now that they can sort of safely re-enter school and re-enter the world, it's hard on them. And so we're sort of working with them. Sometimes they also need help from a therapist or psychologist, whereas others, are ready to get back there. And they're so excited to get back to school and so excited to get back to soccer practice and seeing friends, even if it's distantly and masked. So there is a wide variation. And, it's really about each individual family and making sure that you ask for help if your kids need help, if you need help. As a parent, you have to take care of your own mental health first to be able to help your kids. And kids really, look to parents as, guidance and as security, and they can sense when something's going on with parents if it's not quite right. So if you feel that you need help, please reach out. There are so many resources available, but it's going to be tough to get everybody back to re-enter. It's not simply that we can open the schools tomorrow and everybody's going to be back fine. It's going to be a process.
Yeah. And finally, let me ask you, are you optimistic that things are going in the right direction?
So that's a great question, because last week I was very optimistic. We were going in the right direction. We are reaching herd immunity with those that have had COVID-19, those getting vaccinated. Our numbers are very low, especially here in LA. But over the last few days, there's been some data out of the CDC warning about this uptick going on in many states around the country because people are feeling a little too lax. And with spring break travel coming up, it is a concern. And so although I'm optimistic, I'm still very cautious, and I'm still urging everyone to please keep doing the right thing. This isn't the time to let your guard down. We are so close to the finish line, but we all still need to work together and follow the rules for just a little bit longer.
Dr. Tanya Altmann, great advice. Thanks so much for being with us, and we appreciate all your great advice.
Thank you for having me on. Stay safe.